Welcome back to Decode Healthcare. I'm your host, Harshal, and I am absolutely thrilled to jump straight into this explainer. We're tackling part 23 of our CPT coding masterclass today, and we've got two incredibly important but totally distinct areas of the CPT manual to cover. We're looking at special evaluation and management services, and then we're heading straight into newborn care, including the high-stakes world of delivery room resuscitation. Now, if you've been following along, you know EM codes can be tricky, and newborn codes, well, they can literally be an auditor's dream and your worst nightmare. But don't worry, we're going to break it all down so you can master these rules with total confidence.
Okay, so here's our agenda for today's tutorial. We'll start with special EM services, move into normal newborn care codes, talk about handling ill newborns, discuss delivery room attendance, and finally we'll wrap up with newborn resuscitation rules.
Let's kick things off with Section 1, Special EM Services, and their unique coding rules.
Grab your pens because you will definitely want to write this defining rule down for your exam. For special EM codes, absolutely no active management of the patient's problems occurs. Period. It's purely about establishing baseline data. Think of it like a giant data gathering mission. For example, a patient comes in solely to get a life insurance certificate filled out, or maybe for a disability evaluation. You are evaluating them, sure, but you're not actively tweaking their blood pressure meds or handing out an asthma inhaler during this specific encounter.
So how do we actually pick the right code? Well, it all boils down to the purpose of the exam. Code 99450 is your go-to for a basic life or disability exam. We're talking routine data collection here: height, weight, blood pressure, running through a medical history for a life insurance form, maybe doing a quick blood draw. But on the flip side, codes 99455 and 99456 are specifically set aside for work-related or medical disability exams. This is where you're really assessing a patient's capabilities and calculating impairment, figuring out if someone is actually medically cleared to return to heavy lifting on the job.
Now looking right at the CPT guidelines, notice how they split those work-related exams. You'll use code 99455 if the disability exam is performed by the patient's actual treating physician. But if a non-treating physician is brought in to do that exact same assessment, you have to use 99456. And here's a massive tip for you. If, during one of these baseline exams, you actually do end up having to actively manage a separate problem, you can report the appropriate EM code in addition to these special codes. But, and this is a big but, your documentation must clearly support that separate significant work.
Moving right along to Section 2, Normal Newborn Care Codes, focusing on healthy infants.
Right. Before we even look at the codes, we have to get our definitions straight. In the medical coding universe, a normal newborn specifically means an infant from the exact moment of birth through their first 28 days of life, right up until they're discharged to go home. You really need to lock that 28-day threshold into your brain. It is a hard, absolute rule in the CPT manual for using this specific set of codes.
And here we have a breakdown of your day-to-day newborn codes. It's completely driven by the setting and the timeline. So, you're going to use 99460 for that initial evaluation of a normal newborn in a hospital or birthing center. But if that baby is seen somewhere else, any setting other than a hospital or birthing center, you switch over to 99461. Then, for the days following that initial exam, when the provider is just doing routine rounds on the healthy baby, you'll drop code 99462 for subsequent hospital care. Finally, if the baby is admitted and discharged on the exact same calendar day, yep, there's a specific code for that, 99463.
All right, Section 3, Handling Ill Newborns, and the critical care pivots you need to make.
Now, things don't always go as planned, right? Here is an absolutely crucial point. If a normal newborn suddenly becomes critically ill on the exact same day they already received normal newborn care, all the rules change. Imagine the physician already billed 994060 for the happy, healthy morning check. But later that afternoon, the baby goes into respiratory distress and suddenly needs neonatal critical care. Circle this in red in your manual. You have to append modifier 25 to your normal newborn code, and you bill it in addition to the initial critical care code. That modifier 25 essentially tells the pair, hey, we did the normal check, but a totally separate, significant, and necessary critical situation blew up on the exact same day. Do this right, and you can kiss that audit panic over denied critical care claims goodbye.
Let's step into the delivery room for Section 4, Delivery Room Attendance and Provider Presence.
When you look at the CPT manual excerpts for delivery room services versus subsequent intensive care, you'll see they are completely distinct from each other. We are talking incredibly strict bundling rules here. The codes we use for simply being present at the delivery are not the same codes we use if that baby is later admitted to the NICU for ongoing intensive care.
The guidelines are super strict about cleanly separating the acute, one-time event of the delivery from the ongoing care that happens afterward.
Which leads us perfectly into Section 5, newborn resuscitation and those high-stakes coding rules.
Let's break down the difference between these two codes because it is vital. Code 99464 is what you use when the delivering provider, say the OBGYN, specifically asks another provider, like a pediatrician, to be there for the initial stabilization of the newborn. You're basically on standby, and then you stabilize the baby. But code 99465, that is exclusively for true delivery room resuscitation. The CPT manual does not mess around here. This specifically means providing positive pressure ventilation or chest compressions because the baby has acute inadequate ventilation or cardiac output. Just doing a little suctioning or giving blow by oxygen? No way. That absolutely does not qualify for 99465.
And I want you to listen to this quote straight from the guidelines. Do not report 99464 in conjunction with 99465. The CPT guidelines strictly prohibit reporting these two codes together. Why? Well, it makes sense if you think about it. If you're doing full-blown resuscitation with chest compressions, the standard attendance and initial stabilization are inherently bundled right into that massive life-saving effort. You simply cannot bill for both standard attendance and resuscitation for the very same encounter. You always report the higher-level service, which, of course, is the resuscitation.
So, to summarize these pretty complex rules, while attendance and resuscitation can never be billed together, either one of them absolutely can be billed alongside your initial normal newborn care codes or your critical care codes, as long as it's medically indicated. And here is a real game-changer tip for you. If you actually have to perform a distinct procedure during that resuscitation, like an endotracheal intubation, which is code 31500, you absolutely bill that separately on top of the 99465 resuscitation code. Yes, the procedure is part of the resuscitation effort, but the CPT manual specifically allows it to be reported separately. Do not leave that on the table.
And that brings us to the end of our deep dive into these highly specific E&M and newborn codes. Grasping these distinct rules, especially those tricky modifiers and bundling constraints, is really going to drastically reduce your claim denials. But before we go, I want to leave you with something to think about. What happens if a baby suddenly needs to be resuscitated on day 29? Does it automatically default to pediatric critical care? Well, we are going to tackle that exact dilemma in our next explainer. Until then, don't forget to like, share, and subscribe to Decode Healthcare with Harshal.